I'm Rip Esselstyn, and you're listening to the Plant Strong podcast. Today you'll meet the up-and-coming Brock Star lifestyle medicine physician who trained with Dr. John McDougall, Dr. Neal Barnard, Dr. Ron Weiss, and my father, Dr. Caldwell B. Esselstyn Jr. What a resume. Her name is Beth Motley, and she's coming up right after this message from Plant Strong. I want you to know that we have heard you. So many of you have asked if we could offer a way for people to purchase individual products on our online store at plantstrong.com. Because as you know, up to this point, we've only been offering cases or sampler packs of many of our products like our cereals and our chilies and our broths. That is until now. And as part of the new Plant Strong Test Kitchen, I am thrilled to offer an all-new shopping experience that will allow you to choose the exact number of items that you want for your customizable pantry bundle, and then our team can box it up and ship it directly to your doorstep. And the best part of this is, if you choose 10 items, you'll get 10% off. If you subscribe to your custom bundle, you'll get 15% off in addition to free shipping. And I want you to know we're super flexible. You can change or cancel your subscription anytime, hassle-free, but don't miss out on this limited time offer to personalize your pantry with Plant Strong. Simply visit plantstrong.com and then click on Bundle to explore today. Beth Motley grew up as an athlete and always had a piqued interest in nutrition for peak performance. Once she went into medical school, she quickly realized that nutrition is about way more than just athletic performance. It's about longevity, disease prevention, and even disease reversal. It's about human health. Today, as a family medicine physician who is also board certified in lifestyle medicine, she combines her passion for nutrition with primary care in order to meet her patients where they are and guide them to better health. Please welcome to the Plant Strong podcast, Dr. Beth Motley. Beth Motley, welcome to the Plant Strong podcast. It's great to have you.
Thank you so much. Thank you for inviting me.
Absolutely. Well, you came highly recommended by Melissa and Doug Sturgis, who came to our Black Mountain retreat a couple months ago, and they're like, this woman is incredible. And so, in doing some research into you, you do seem incredible. And so we're going to find out just how incredible here over the next hour or so. But Beth, tell me, where am I talking to you from?
Well, I'm actually at my neighbor's house in Greenville, South Carolina, because I've got an infant and construction going on at my house. But yep, Greenville. I'm from Massachusetts, but have made my way down south a bit.
Wow. How do you get from Massachusetts to Greenville, South Carolina?
That's just kind of how medical training works. It's very linear. You hop from one place to the next. And I had done undergrad and medical school in Virginia, and I Googled best places to live for young people. And part of the reason I chose Greenville was for sports medicine, thinking I would go into sports medicine. But I went to a sports medicine conference, and, I am a former athlete. Still an athlete. I went to a sports medicine conference, and I found myself the whole time not paying attention, and instead just reviewing information about plant-based nutrition and how can I help my patients. And that was my sign that I had to go instead from sports medicine, to lifestyle medicine where I am today.
Right. And so what is your current medical practice, your family life, or your family medicine? Is that correct?
Yep. So I'm family medicine, subspecialty lifestyle medicine. I was lucky that I completed my training in 2017, which was the first year that lifestyle medicine certification exam became available. So I went ahead and took that, and I was in the first class of lifestyle medicine physicians. So I work in a general family medicine practice for a large medical group. I am a busy mom, so the idea of running my own practice is very daunting. And I like to be able just to show up to work, do what I am good at, and leave, and not worry about, anything else that is involved in running a medical practice. So when I signed on, I assumed I would just be doing general family medicine, and, maybe someday I'd open an amazing lifestyle medicine practice. But little did I realize, just due to my interest in lifestyle medicine, that was becoming my practice. So now, while I do full scope primary care, I tend to work with patients who are interested in a lifestyle medicine approach. So I always say I'm not anti-medicine, but I am pro-lifestyle. Before we jump into medications, we always talk about what we can do in our lifestyle.
Right. So before we went live here, you and I we both were talking about how John McDougall, who was absolutely one of the pioneers and heroes of the whole food plant-based movement, passed away a few days ago. I'm wearing black. I just found out. I literally just found out like an hour ago, and I'm
Yeah, me
just kind of
too.
like, heavy-hearted and just dumbstruck, thinking that at 77, John is gone. We all know that I think it was age 21, he had that stroke,
Mm-hmm.
and so his health, was maybe always a little bit subpar. I mean, I hate to think if he hadn't found whole food plant-based, what it would have been like. But I know that you said that he's one of the people that inspired you to go into lifestyle medicine. Can you explain that?
Absolutely. Right. So I grew up figure skating, and as a figure skater, I first became interested in nutrition as a means towards performance. There were a lot of good figure skaters out there, and I was just, one of the pack. I was a little on the scrawny side, so I was trying to figure out, what could I do in my power to stand out? And I just assumed, why not focus on nutrition? That's something that a lot of my peers at that young age were not focusing on. And so, as an adolescent, my interest in nutrition really just meant reading whatever was popular. I didn't really understand nutrition from a medical perspective, from a chronic disease prevention and longevity perspective. But I always carried that interest with me. And even in medical school, I considered it a side interest. And
Huh.
I had done an away rotation at Duke, and I met a resident there who had worked with John McDougall, and just chatted with him. And he, heard about my interest in nutrition and sports and athleticism. And he's like, "You've really got to go work with John McDougall." So I worked with McDougall. I was there for the 10-day program in January of 2014. And as a medical student at the time, I was in charge of doing all the blood pressures in the morning and, checking in with patients. And it was an absolute incredible experience. 10 days just to see, just by day 2 and 3, people's complexion improving, their mood improving. I just remember on day 1, 15 out of 60 patients, I had to report the blood pressures to John McDougall because they were in the alarming range. And by the last day,
Yeah.
there was only one guy who probably had some underlying kidney disease or something, that was not reversible with diet. But only one guy still had high blood pressure by the end of those 10 days. So that was just, it was comprehensive, live-in program. They'd go there, you'd eat all the food, there's the proof of concept right there in the 10-day program. It was absolutely, totally inspiring. And that's why I was like, someday I want to run something like this, but for now I'll just do primary care. But yeah,
Wow.
absolute inspiration. And after that, actually, I asked John McDougall, who should I work with next? And he pointed me to Neal Barnard, so I did a rotation with him, and also to your father, Caldwell Esselstyn. So I stopped by and did his heart disease reversal program. And then I worked with Ron Weiss, who's a physician
Okay.
farmer in Long Valley, New Jersey. So it was just an incredible experience.
Wow. You really made the rotation there. So McDougall, Weiss, Esselstyn, and Barnard.
Yep. And then I also challenged myself to look at some different perspectives, working with people in like integrative medicine, functional medicine, maybe not exactly what speaks to me, but similar areas. I even did 2 weeks of bariatric surgery. I really wanted to see what my future patients are going to be exposed to, and really get like a broad knowledge base there.
Wow. I'm impressed with your open mind. What do you think has allowed you to have such an open mind to bring in kind of new philosophies and new ways of looking at things?
Well, I think there's a lot of rejection of the unknown in medicine. We're comfortable with what we know and what we learn in medical school. And when people introduce new information, it's inconvenient as a provider. First of all, we have to go look it up and figure it out if it's right or not. And, we're pressed for time. I think a lot of providers reject things that they don't know and they have their own protocols. And if you think about it, anything that is alternative medicine today, meaning something that we don't have the scientific evidence base to support its use to treat whatever condition, right? It's alternative medicine until we have the science and the data that support it, and then it becomes, classic medicine. For example, Tai Chi, that would have been considered alternative medicine many years ago, but now we have all sorts of research studies that talk about the benefits of Tai Chi, for older adults who may be debilitated or who have chronic back pain, something like that. So, especially with my interest in primary care, I know my patients are just going to have questions about all of these things. And in primary care, we're going to have patients, asking for advice on new things and what they hear in the media. So I feel like that's part of my role in primary care is to have that broad knowledge base.
Yeah. Well, what's interesting to me is so you also have a background as you said, a figure skater. From what ages did you figure skate from?
So I started at 4 years old. I grew up with three sisters and a brother. And so figure skating was something that was available in town, and my parents could bring all four of us sisters at the same time, which was convenient for a few years until we got more serious, up until I completed high school. So in my final year of high school, I was lucky to make Team USA, which was such an incredible experience, but I knew deep down I was not going to be a professional figure skater for the rest of my life. So I gave it up when I went to
Right.
college. And
Right.
I still dabble once a year, but I'm not very good anymore.
Wow. So could you do what's it, a double axle or whatever?
Most people ask triple axel. I,
No, no.
I did team figure skating, so synchronized skating. I was on the Hayden Nets, if anyone on the out in cyberspace knows the Hayden Nets out of Lexington, Massachusetts. So I was lucky that where I grew up in Massachusetts, I just lived 22 minutes away from where Team USA practiced. So I was the closest one to the rink pretty much all around.
Wow. You were probably training, would you say, what, 2 to 3 hours a day?
Oh, a lot. Yeah, a lot of training. Um, yeah, at four days a week was just the team practice, and then individual practice outside of that. Sundays we would practice 3 hours in the morning. We'd have a 3 hour break and 3 hours again in the afternoon. So yes, definitely a lot of practice.
Oh my goodness gracious. Do you look at a pair of figure skates and do you get PTSD or are you good with
No,
them?
no, no. It was great. It was a great experience, and not just from the athletic perspective, but to be a part of a community, and just
Mhm.
growing up together with other figure skaters as a team. So yeah, it was great.
Yeah. Well, I'm glad to hear that. It's interesting. I'm just kind of thinking about, in the kind of plant-based community,
Mhm.
some like my father who, won a gold medal in crew, Scott Stoll, who made the
Mhm.
U.S. team, the Olympic team in the bobsled, Joel Furman, who won, some national championships in figure
Figure
skating.
skating, yeah, he's
So,
my buddy.
yeah. So I think that there might be something to kind of being a high level athlete and always looking for ways to improve your performance, which then carries over into medicine where you're kind of always looking for something that might be a little bit better, a little bit smarter, a little simpler. You know what I mean?
Mhm.
Yeah.
Yes, yes, of course. I really enjoyed the recent New York Times bestseller, Atomic Habits.
Mm.
And I'm sure you've read it, but something that really resonated with me is how just simple 1% changes in your life can really compound over time. And even though you may not see it immediately, within a year, you will. Um, so I, as in my role in primary care, I tend to simplify things for my patients. So, like the simplified way I would talk about this is that if you can eat well, right, more plant based equals more anti inflammatory.
Hmm.
That will help with muscle repair and perhaps allow you to train more frequently. And in a lot of young athletes, we're not dealing with things necessarily like high blood pressure and hypertension. A lot of times we'll see that, in our 30s and 40s. But it does make sense from that, Atomic Habits 1% improvement perspective. If you can make those simple improvements like eating better, even though you may not see it, they do add up over time.
Yeah. Yeah. Well, give me an example of um, what is a way with your patients that come in where you're trying to get them, and I know one of your philosophy is you kind of like to meet your patients where they are.
Mhm.
But give me an example of maybe a small improvement that will add up over the course of a year.
Sure. I was just chatting with a patient earlier. She has high cholesterol, and in my world, everyone has high cholesterol until proven otherwise. That is pretty much the softball in lifestyle medicine. She's similar to me, stage of life, female, similar in age. Uh, and you know, she's not plant-based, but she's open-minded. And anytime I get lab work back, I say, hey, it looks like your LDL, your bad cholesterol is a bit high. Cholesterol is only found in plants. Uh,
From animals.
totally. Let me try that again. Cholesterol only comes from animal-based foods. Animal-based foods are also our number one source of saturated fat, which turns into cholesterol in our bodies. On the other hand, fiber is only found in plants. Fiber helps to escort that cholesterol out of our bodies. So I just ask her, do you have any ideas about what kind of changes you can make? She said, well, I do have eggs every morning. So the plan we came up with today is that we're going to do a 6-week trial. She's going to swap out her morning eggs for oatmeal, and
Mm.
we'll check her lipids at the end of 6 weeks. So I really like to use lab work as leverage, in particular cholesterol, because that is one that almost everyone has high cholesterol and it responds very quickly to dietary changes.
Oh,
And that was something huge that I saw when I worked with John McDougall. Within 10 days, huge changes. I have an album of lipid panels that I stopped adding to it because it's just absurd how quickly your cholesterol can improve on a plant-based diet. And I love to hear people arguing otherwise. Oh, dietary cholesterol doesn't matter. I'm like, yes, it does. Absolutely does. So it's important with patients to hear the words come out of their mouth, right? So, what ideas do you have? It's my role to educate them, right? For example, like we need to move more plant based. And then my question to them is like, what do you think you can do to work towards that goal?
yeah. Why? Let me ask you this. So, if you know as well as I do that we can make some significant changes in total cholesterol, LDL, triglycerides in really like 6 to 10 days, why 6 weeks? Why not 2 weeks? I mean, why give
We
her?
can do that.
Yeah.
Well, we're also adjusting a little thyroid medicine on her, so
Okay.
6 weeks is
Okay.
convenient.
Okay. Okay.
Yeah. I mean, I'd say 6 weeks. When I have a new patient in the office, I do a lot of, deep dive in lifestyle medicine. And also, there's just a convenience standpoint where sometimes people just don't want to be coming in every 2 weeks. So, eh,
Right. Right.
you know, it can be any amount of time. It can be 2 weeks, it can be whatever they want. But yeah, you don't really need more than a week to see those cholesterol numbers come way
Yeah.
down.
What, in your opinion, what do you consider to be elevated cholesterol?
So you will see different guidelines out there. As Caldwell Esselstyn would say, LDL less than 70 is essentially heart attack proof. We just don't tend to see heart attacks in people with an LDL below 70. And also, if you look at data, we see communities that have LDL less than 70 have the lowest risk of heart disease. And if you consider a total cholesterol up to 200 as normal, there's still about 25% of people who have heart attacks have a total cholesterol within that range. I forget the exact
It's
statistics. I'm going
180.
to look it up.
I do. I saw it on your website.
Oh, 180 to 210, was that it?
180 to 200 is where 25%
Yes,
of
exactly.
heart attacks happen, where the American Heart Attack
Right,
Association.
exactly. Would say that's an acceptable
Yeah,
range.
yeah, under 200.
Um, yeah, exactly. So the patients have a hard time with that because, the EMR will only flag it as abnormal if it's above 200 or if LDL is above 100. But,
Yeah,
I definitely push them towards less than 70 as a goal.
yeah, yeah. So in your medical practice, you and again, I learned a lot about you from your website, which is very informative. But you say you have this classic medical model where you've also flipped.
Right,
You
right.
have a
Like a
flipped
flipped classroom
classroom,
style.
yeah, practice style. What does that mean? Flipped class.
Yeah. So let me give you a little background. So in my practice, I am employed within a standard insurance-based medical practice within a large medical group. And part of the reason I like to practice in this setting is I like to be accessible to the whole community. Private practice has its pros and cons, but I felt if I did private practice, I would not be accessible to a lot of people in the community who prefer an insurance-based model. And when you are in an insurance-based model, of course, time is of the essence, right? And so that's always the complaint. People say, "Oh, my doctor's so rushed. My doctor doesn't have enough time." So I think you can do a good job being efficient without being rushed. So I like to sit down with the patient, really figure out what are your goals, right? That's something that not everyone has even thought about, but opening the discussion with what are your goals allows that person to verbalize, oh, what are my goals? Maybe it is to lose some weight. Maybe it is to get control of my high blood pressure. And then I really assess where they are. Are they pre-contemplative? Do they not even know they have high cholesterol? Are they contemplative? They know they have high cholesterol, but don't really have any thought about how to address it. Are they in that preparation stage of change where they're starting to think about doing something? Or the action stage, they're taking action, or maintenance, someone who's maybe already on a plant-based diet, we're just working on maintenance and tinkering. So have a good assessment of where they are, and then I will provide resources to maybe move them up a ladder on that trans-theoretical model of change. So for example, I often refer people to documentaries. Forks Over Knives is a huge one. I also really enjoy the Game Changers, just depending on who my patient is. So I'll give them some homework to do on their own time. I also often refer to books. Like I mentioned, Atomic Habits is great. Your book often goes hand in hand with the Game Changers. For my men, for my athletes, people who I think those messages would resonate with. For those who have heart attacks, particularly a lot of my older men, I might refer them to your father's book. And then for diabetes, I'm often referring people to Neal Barnard's program for reversing diabetes or Mastering Diabetes,
Mm.
which is a book or a program. So I really like to sort of take a snapshot, figure out where they are and what they need to move towards success, and then give them some resources to start working on that. I
Yeah.
also have some health coaches I use, or there's some people who, their main problem maybe is not dietary. Maybe it's we need to work on sleep and stress management. So there are 6 pillars of lifestyle medicine. Of course, my focus tends to be most on diet because I see that to be a big area of confusion and an area where people can make a lot of change.
You're right. You say that your favorite diagnosis is diabetes.
I love diabetes.
So
Well,
explain to our listeners today why you love diabetes.
there's a lot of confusion with diabetes. There's a lot of confusion. And, if your goal is to lower blood sugar, if that is your goal, there's 2 ways you can achieve that. You can do the standard approach of, a more low carb eating style. The problem with that is that pushes you towards more high fat foods. A lot of people who are eating low carb may be doing meat, they may be doing dairy and probably some vegetables, but they're missing out on the whole grains and the beans. And you can do that, and you can make your numbers look better, at least somewhat, at least in the short term. However, you're not addressing the underlying problem, which is the fat in our muscle cells, the intramyocellular lipids that are underlying insulin resistance. And so it's very backwards thinking, right? People think about diabetes and they think about blood sugar. High blood sugar is not the or high sugar is not the cause of diabetes. Diabetes causes high blood sugar, right? So the solution is not a low carb eating style if you want to reverse that fat buildup in the muscle cells. So I have a YouTube I made, if you just Google Beth Motley diabetes, that really explains that concept of how if we move to a more plant-based diet, sure, in the next few days, your blood sugar might look a little bit higher, but very quickly you will start to remove and discard those intramyocellular lipids that are causing the insulin resistance. So it's a total new way of thinking. And it's wonderful that the American College of Lifestyle Medicine has put out some resources, not just for physicians who want to be trained in that approach, but also for patients who want to learn more about that approach to treating diabetes. And also with diabetes, the A1Cs you get every 90 days can really show someone how much they change. So I've had patients, A1C up at 11 or 12, able to change their diet and get it way down, 6 or 7. I have a patient who's been off insulin now. He's been my patient for, 8 years or so. And he was on 30 units of insulin when he came to me. And he had been doing Neal Barnard's program, which is all the same. It's a, Whole Foods plant-based, a little more focused on low fat, which in general, Whole Foods plant-based is lower fat, but one step further by removing things like nuts and high fat plant foods. And he's been off insulin for 6 or 7 years now. It's amazing to see. I think patients are so thankful to be able to get off those medicines, be able to avoid or greatly reduce insulin, and the proof is right there. The proof is in the numbers. If I can get people to make the change, they can see the numbers. They really understand that it works.
Yeah. How do your patients usually respond when they come in and let's say they have an elevated A1C that's in the 6s, 7s, or 11s or 12s,
Mm-hmm.
or they have a fasting blood sugar, above 125? I think that also is indicative of maybe having some diabetes going on. And you say, let's try this whole food plant-based diet. It's not the sugar that's causing the diabetes, it's the fat. And they're a carbophobe. How hard do you how far hard do you have to convince them? Because as you just said, this is kind of a new way of thinking. Unfortunately, it's really, technically it's not. Some of my very, very good friends are Cyrus Kambata and Robbie Barbero.
Of course. Yes, I know them.
They show the research going back to 1918, showing that this is something that works really, really well. But in the medical field, it seems like, this is this new age way of looking at diabetes anyway, I'm digressing. So, so how do they respond when you say, hey, let's try this method?
Well, I don't necessarily even tell them let's try a Whole Foods plant-based diet. I typically start by, I want to nudge, and they're usually overwhelmed, right? If it's a new diagnosis of diabetes or they don't realize they have it, or, they're thinking through a lot. So that is why I refer them to my YouTube, because I think it's a very confusing concept about using a plant-based diet to reverse the insulin resistance. And I do feel like patients need to understand why they're doing what they're doing, for them to effectively do it. I've not always been the greatest rule follower in my life, but I like to say, I follow the philosophy behind the rules. So for me, if I don't understand why a rule is in place, I have a hard time following it. So yes, for my patients, I really want them to understand the science. So I put together that YouTube, tried to really simplify it. And depending on whether they have a science or medical background, Neal Barnard, I find that to be more 101 for someone who's a new introduction to the concept, or the Mastering Diabetes book is more 201 for someone who's on the road and is doing a little more detail work. I also have a handout I go through, and all this is available on my website under my provider tools there. It's called Understanding Carbohydrates, and this is something Jeff Novick helped me with many years ago, back after I had worked at the McDougall program. But just explaining carbohydrates instead of, complex and simple and all these words that can get confusing, talking about carbohydrates as, either unprocessed, minimally processed on one end, and on the other end, we have processed. I don't like to villainize an entire macronutrient, right? The goal is not to avoid all carbohydrates. We want to avoid the highly processed carbohydrates. So that's another concept I try to review with patients is, what are the right kind of carbohydrates that we should be consuming? Because that is definitely difficult. Carbophobia. I didn't even know other people use that term, but yes, that's something I talk about. A lot of my patients are carbophobic. They're afraid of carbohydrates, especially if they've had that diagnosis for years. It's ingrained in them. And then you tell them that we're going to eat more plant-based, and then they don't know what to eat. And then a failure would be for them to go home and just eat lettuce and tomatoes for 2 days and say, I can't do it, and give up. So I really try to give them the resources to be successful.
Yeah. Well, on your website, you have when you click on, I think it might be carbs or one of them, you have a great graphic chart that
Yes, that's
shows
the one. Yeah.
from unprocessed all the way to highly processed and what it
Right.
looks like.
Right. Exactly. For different food types. Yep.
Yeah, yeah. And I do have to give you a great, big, wonderful shout out because you make everything available, just kind of all these resources. You're very open with them. You have a link to basically your I think it's your G drive
Yeah.
where you
Yep. Yep. Yeah.
yes,
All my patient handouts.
all your handouts and documents. It's just there for anybody.
They're,
It's really wonderful.
I have
Yeah.
made several of them, but I have also curated that collection because there are lots of good ones available for free online. So that's what I have tried to come together, or tried to bring together. But what's funny is, I feel like I'm locally known for my handouts and,
Mhm.
office style. But when I started out after residency, I completed residency in 2017. I only had one or two handouts, but then you get patients who come in, they have the same question, same question, same question.
Yeah.
Like calorie density is a big one. That's another concept I find myself going through a lot. And so I have a few different handouts that really focus on calorie density and what is that concept and like what foods should we be focusing on, or even like your dad's book, my patients who have heart disease who are doing this, really strictly to try to reverse their coronary artery disease. I refer them to Caldwell Esselstyn's book, but at the same time, I have a handout that's just a one-page summary of the book. It's like a quick start. Okay, here's the book that'll help you learn the science behind it, and here's the quick start guide so you can go ahead and get started tomorrow.
Yeah. So you said a bunch there. Let me just reflect on a couple things. One, you say you love talking about calorie density. Calorie density is to me, an important pillar of really understanding whole food plant-based. And I too learned the vast majority of calorie density from Jeff Novick. Just
Mm-hmm.
absolutely
Yep.
brilliant presenter, calorie density, and so many other things. How to read a food label. How just for the audience, because I think it bears repeating, and my father loves to say repetition is the mother of learning. What would be your 1-2 minute summary of calorie density?
Right. So a lot of times when I'm I'm working a lot of times when I'm working with a patient on calorie density, it's because they have expressed that their goal is weight loss, or perhaps they have high blood pressure. They're maybe eating plant-based already and doing a little bit better, but they still haven't lost all the weight and they still haven't really gotten off those blood pressure medicines that they hope to. So I really bring back the discussion to what are our goals? Our goal is to, optimize our blood pressure. We know that having an optimal BMI will help us to optimize our blood pressure.
Mm.
And so there's a lot of confusion because people are like, oh, nuts are good. Nuts are healthy. Avocados, those are healthy fats. Oh, I do olive oil. I don't do other oils. I have to bring them back to what is our goal? If our goal is weight loss, we need to focus on choosing those foods that fill us up without costing us too many calories, right? Um, Oils, no matter what kind of oil, olive oil, coconut oil, avocado oil, whatever oil you choose, it is going to be 120 calories per tablespoon. So if your goal is weight loss, adding oils to your, salad, adding oils to whatever you're sautéing on the stove, even if it's a preferable oil like olive oil, it's not going to help you to achieve that goal.
Yeah. Yeah.
I used to love peanut butter and I just had to give it up because I'm like, it's just not worth it, just not worth the calories. But like nut butters are a common one, nuts, like, and for my normal weight patients, kids, whatever, I'm okay with some nuts. But if someone's goal is weight loss, nuts are not going to help you to achieve that because calorically they're very expensive.
Mm-hmm.
Um, so I do often refer to McDougall's Maximum Weight Loss book. That's a great one. And then I have an infographic of his 50-50 plate, which basically means, fill half your plate with the least calorie dense foods, the fruits, the vegetables, the mushrooms, berries, and the other half with those plant-based foods that may actually provide you some more calories, the whole grains and the beans.
So Beth, I love what you said about, calorie density. What is going to fill us up without costing us too many calories, especially if the goal is to find that BMI or achieve weight loss. My question to you is, I mean, how many patients is it about that you have? Is it about weight loss, and how many is it about optimizing their overall health with a wonderful byproduct being the weight loss?
Yeah,
I,
well,
I
it's
find I find it's a tricky mentality, and when it's purely weight loss, it seems to be kind of rooted in a little bit of, I don't know, unhealthiness.
yeah, yeah. It's actually a package deal. I mean, you eat better, everything improves. So from my end, it's like what is going to motivate the patient or what is going to capture the patient.
Mm.
A lot of times I have patients with 10 different diagnoses and I know the answer is going to be a plant-based diet, but maybe I'll focus on cholesterol, or maybe if I think, they're fairly new to this area, this could sound intimidating. We'll just focus on cholesterol today and see where we get. In general, I wouldn't introduce calorie density until we get someone eating more plant-based to start with.
Mhm.
So I try to figure out, what diagnosis most motivates them. Another one we'll see is arthritis. I mean, that's an easy one. If someone's in pain, we can work on a more anti-inflammatory diet, aka a plant-based diet. If they're in pain every day, that's what's going to motivate them. So I may present information about plant-based diets and arthritis to guide them down that path, knowing full well that we're moving plant-based and that's going to help all of their diagnoses.
Yeah.
So usually I move them plant-based, and then once we're there, then for most of my patients who do need to lose weight, then calorie density is, one of my later steps that we take.
How do you feel about the latest, craze going on with Ozempic and Wegovia? And I'm sure your patients are asking about it.
They
Love,
are,
love to know,
yes.
love to know what you do.
Yeah. Well, so I always say I am pro lifestyle. I'm not anti medicine. I would
Mhm.
say that former me used to be like completely against any of that, under the assumption that I'd be enabling patients, just like they say with high blood pressure. Like,
Mhm.
oh, you just treat their blood pressure, then they're going to lose their motivation to address it on their own. So I would say that used to be my philosophy, thinking that if we use these medicines, um, people are not going to learn to eat well. But I have found naturally that is not necessarily the case. And like what I experienced with the McDougall program and seeing people make the change, and 10 days later they felt so much better, and it was positively reinforcing, and they would never go back to their old selves. I have found that using the GLP-1 medicines can actually help people to really hit the reset button, help them to get the weight off, give them a little more motivation. A lot of times for people, if they're overweight, that's wrapped up into mental health, possibly depression. They're not sleeping well, they're not exercising. So I ideally would see this as a tool when it comes to weight loss for someone to help them lose the weight along their lifestyle medicine journey, with the goal to be to use that time while they're on the medicine to develop skills. I really focus on fiber. Sometimes I refer people to the Full Plate Living program. It's fullplateliving.org, just some great free information about, moving towards a more plant-based diet. So if we are using those medicines, I really like to use that time to focus on lifestyle medicine with the hopes that once we get them to their goal, that they have the skills to maintain it off them. So
Right.
I do use that medicine plenty, of course, in my patients with diabetes. And it's really incredible because once we are able to get the weight off, a lot of times we don't even have diabetes anymore. So
Yeah. Yeah.
as an MD, I do use some medicines, but my goal is always lifestyle, right? What can we do in our lifestyle?
Right. So, but in many cases, it seems to be a effective 1-2 punch. So the Wegovia or the Ozempic with, let's say, whole food, plant based. And what is your understanding? Like, how much does it cost a patient to be on these drugs?
Uh, Very expensive. So right now we are primarily seeing insurance companies cover these medicines for people who have diabetes, who are already on or have failed to oral medicines or to other medicines. So those are primarily the patients that I have on it, are people who have diabetes. Um, there are a few insurance companies that are paying for it for weight loss, and we are seeing some of them cover it for weight loss in people who also have some documented heart disease. Outside of that, they're very expensive, like $1,600 a month, I believe, is the
Yeah.
going rate for name brand semaglutide. So it is expensive, and that's obviously not, affordable and sustainable for a lot of people.
What are you seeing with your patients as far as any potential side effects with these
Yeah,
drugs?
right, right. So you have to weigh the pros and cons. So part of the way the medicine works is by slowing down your GI system. That has the desired effect of making you feel more full. But of course, at the same time, if things are slowed down, that can present as nausea on one end or possibly constipation on the other end. So if we are using those medicines, that is all the more reason why I'm working with a patient to focus on fiber, right?
Uh,
Because not only is fiber, I explained to them, a dietary appetite suppressant. The more fiber we can consume earlier in the day, the fewer calories we tend to consume overall. Michael Greger's done a lot of great videos about, fiber and exactly that, how we tend to consume fewer calories when we focus on more fiber. So if we are using those medicines, that is all the more reason to focus on fiber. And really, a lot of these people who are seeking these medicines are people who are discouraged. They have tried a lot of things. They've tried a lot of different diets. They're really looking for help. And so I do find a lot of people who are on those medicines are also motivated to make the changes.
yeah. When you how many? Give me a rough estimate. How many patients are you seeing a week? Are you seeing 50? Are you seeing 20? I have no idea.
I work part time, so I'm seeing 40 patients a week.
Okay, okay, 40 patients a week. And how many of these, let's say on average, 40 patients a week that you're seeing, would you say are inactive, meaning they're not moving, they're not exercising? And how?
Um,
Yeah, yeah,
yeah. A good amount. I really try to ask about physical activity instead of exercise, because there are a lot of people
yeah.
who are naturally active throughout the day who may not be doing what we label as exercise. There's a good amount that are inactive. And again, this is another case where former me would have been very blaming of the person who doesn't exercise. Um, I think a lot of people want to exercise and they want to be active, but there's only so many hours in the day, and maybe they haven't thought through
Mm,
strategies for for incorporating that. Or there's a lot of people who, work 40 hours a week and they have stressors at home, or they have parents who are sick, and it can be really hard to fit that in. So it's important to talk with patients about strategies for how can you fit that in. Like, so I have a bunch of kids and I'm very busy, and despite working part-time on my other days, what do? I work. I mean, I'm very busy. And so for me, one of the ways I can incorporate physical activity is by walking to the grocery store.
Mm.
And it's only, I don't know, a mile away. And I take my stroller, and I get all sorts of terrible jokes from people about, where'd your baby go? I know, I just bring the empty stroller, fill up my groceries and walk home, because it almost takes the same amount of time, if it's a mile away, to like walk there and park and get in, and then, load up your grocery cart, load up your car. So that's one strategy I have used to incorporate more physical activity into my own life. So that is really what I like to work on with patients, is figuring out how we can integrate more physical activity into their daily lives. If they have time to do, formal exercise, that's awesome. Weightlifting, especially for my postmenopausal patients, or for anyone who might be on a GLP-1, weightlifting, I think is wonderful. And we do have an amazing program called Exercise is Medicine down here that Jennifer Trilk, who is one of the professors at the medical school, she really helped to pioneer that, where I can make a referral to the YMCA for my patient, and they get enrolled in this Exercise is Medicine program. They meet with a trainer twice a week for 12 weeks to help them. It's basically like just helping people get into the gym. Like, even me personally, I mean, I have a good exercise resume from my past experiences, but a lot of people like don't really know what to do in a gym. I mean, even I feel like if you just put me in a weight room, I would be like, oh, I need some structure. So that's a
Totally.
really great program that gets people in the door at the gym. And also, while they are enrolled in that program, they have full access to the local network of YMCAs here. So
Mm.
for me, group fitness has always been a big part of my past, because all I have to do is show up, and then someone else tells me what to do and keeps me motivated. So that's a really wonderful program to get someone in the gym, to give them some structure, some accountability, and also allow them an opportunity to maybe explore some of the other programs that the YMCA offers. So I'm
Mhm.
also a board member for the YMCA because I love the Y and I love what they do for the community. Um,
Go
but
Weiss.
yeah, so exercise, you can't just tell a person to exercise. Oh, you need to exercise. You need to do your 150, minutes a week. That doesn't work. You need to let the patient express, what might work for them or how they can integrate it into their life.
Yeah. Has the pickleball craze hit Greenville?
Oh, I love pickleball. Yes, it definitely has hit Greenville. There's all these extra courts opening up. We're about to
Yeah.
build some at the Y also.
Good.
Yeah, I played a few times while pregnant, and I think I was scaring everyone, so I haven't picked it back up since I had my baby, but love
No.
pickleball.
Well, so
It's
speaking of
great.
babies, I'd love to talk about. My understanding is you have 5 children. Is that right?
Yes, I do have a lot of kids.
Five,
I only
5 kids.
birthed 4 of them. So my 10-year-old I have through marriage, and I am her full-time mom. So her mother passed away at 29. She had colon cancer.
Oh
So
my
that
God.
was part of, when I met my husband, that was something I sort of brought to the table, is he didn't know much about cancer and diet. And as you know, within classic medicine, it's something that's often not talked about. However, colon cancer is multifactorial, but a big part of it, may be diet. So that's yet another motivation for our family to eat more plant-based.
Mm.
And then we have 4 other kids, ages 4, 3, 2, and 5 months. So
Wow.
it's very hectic, but it's a lot of fun. Um, and I would say I've had to come up with a good strategy. I would like to raise kids who can make good decisions on their own. When I was growing up, I grew up, in a Catholic family in Massachusetts, and I would say church was something that was forced upon us, and I did not have a good experience with church growing up, right? And I don't want that for my kids. So same
Mm.
thing with, diet. our philosophy is this is the way we eat at home. And when we go out to restaurants as a family, of course, this is the way we eat. But when my kids go to friends' houses, when they go to birthday parties, that's their time to make their own decisions. Because I do want to ultimately raise kids who are going to make their own good decisions. And, it's a tricky thing to navigate in this very non-plant-based world.
Yeah, good for you. That's incredible. All those kids 10 and under. And what you said, a 5-month-old?
Yeah,
Wow.
yeah.
Wow.
The
Good
little
on.
ones, four,
Good.
4, 3, 2, and 5 months. So it's wonderful.
Holy. Wow. I mean, that is as close as me and my siblings. There's 4 of us and we're 4.5 years apart.
Oh, like within a 4 and a
Yeah.
half year window? Yeah, that's how my little ones are. Yeah, they're all within 4.5 years. Yeah.
Wow. Were any of them birthed within 12 months of each other? Like,
No, no, no Irish twins in
no
there.
Irish
So
twin?
the four little ones are all 18 months apart
Okay.
each.
Okay.
Yeah.
I have a brother who's 11 months younger than I am, so we're Irish twins.
Oh,
Crazy.
wow, that is pretty cool. That is
Yeah.
pretty cool. Yeah, I
Yeah.
grew up in a large family myself. I have 3 sisters and a brother, so
Wonderful.
I'm not new to the chaos.
Now, so with all these kids and your husband, who's doing the cooking in the house?
So my husband and I are different. He's the foodie, right? He's the super chef. And I'm more of the functional eater. I'm like, I'm busy. I'm just gonna microwave a sweet potato. At work, if you open my cabinet that should include lots of textbooks and medical references, it just includes a bunch of beans, and I just like open a can and just put a spoon in. And for me, it's more function. So I think we've found a good balance where he's sort of the dinner chef. He likes to do fancy dinner stuff, and I'm more of the
No.
the lunches, the desserts, that sort of thing, the snacks. That's more me. So we made peach ice cream last night, and luckily my kids don't really know what real ice cream is, and so we just froze a bunch of peaches from the farmer's market and just blended them with some cashews, and ice cream. Kids go crazy. So that's more my role, and I like simple stuff. If I'm going to make something for the family, it's probably going to be, in the crock pot or the Instant Pot, or, some sort of easy blender dessert like that.
So 4 kids that you birthed, and I am assuming that you were whole food plant-based through every pregnancy.
Yep, I
Yep.
definitely was.
Yep.
Yep.
And
Yep.
so
It
any tips or advice that you would give for mothers out there that are pregnant or wanting to get pregnant and are a little bit maybe gun shy about doing it on a whole food plant-based diet because they're afraid they're not getting all the nutrients they need?
Well, it's a common misconception that they would be nutrient deficient, but really it's just the opposite. A plant-based diet is the most nutrient dense eating style. I have a nice handout I use to explain that concept. Obviously, you're going to want to take some B12. The
Yeah.
safest package to get B12 is in a supplement, rather than animal-based foods. And you'll want to take a prenatal too. With my first pregnancy, I was like, oh, I don't need a prenatal. I'm just going to double down on beans and greens and get lots of iron and lots of folate. I still became anemic. So just take your prenatal vitamin. Um,
Yeah.
yeah, I mean, it's really not that difficult. And eating plant based, I think, helped me to avoid some of the common complaints with pregnancy, right? So a lot of women experience constipation. Not only does that progesterone potentially slow you down, but also if you're taking an iron supplement, that can constipate you. So we see a lot of pregnant women who are backed up and they've got hemorrhoids and all sorts of terrible stuff that nobody talks about. By eating a more plant-based diet, really focusing on fiber, that should
Mhm.
not be as much of an issue. And another common thing we see in pregnancy, well, first of all, if we are not healthy prior to pregnancy, that puts you in a higher risk category. So if you can optimize your BMI prior to pregnancy, that is a wonderful thing to do. You will have a lower risk pregnancy if so. But also hypertension is a big deal in pregnancy. We don't want our patients to have preeclampsia. We want to avoid that at all costs. So we know eating a more plant-based diet absolutely is going to help from the blood pressure perspective. I can't think of a reason not to eat more plant-based while pregnant.
And what about gestational diabetes?
Yes, that is another one. Gestational diabetes is something that pops up in a lot of people who are totally not anticipating it. And having gestational diabetes is a risk factor for having diabetes later in life. Really, I think when women get pregnant, we are able to figure out, which women, assuming they follow their same lifestyle going forward, are going to pass that threshold into diabetes. So all the more reason to eat more plant-based in patients who do have gestational diabetes. To start with, I am not their OB, so they will work under their OB. But in general, I will refer them to the Mastering Diabetes program to really help them start to make some dietary changes.
Yeah. So you mentioned earlier as a athlete, as a skater, and I think to some of these athletes that you're seeing, you recommend a kind of whole food plant-based diet because it's the most anti-inflammatory eating style out there. Um, would you recommend the same for somebody if they want to prevent cancer? And can you kind of explain a little bit about the whole food plant-based
Right,
and how this anti-inflammatory eating style is helpful in maybe preventing
right,
major
right.
cancers?
Yeah, so cancer is interesting. It's a little bit of a harder diagnosis for me to work with patients on because I don't necessarily have lab work that I can follow. It's
Yeah.
also something that's often multifactorial, and we have like lots of different cancers, um, with lots of different factors at play. So when it comes to cancer, we see a few things. Number one, um, people who have an optimal BMI have a much lower risk of cancer, right? Obesity is a risk factor for almost every sort of cancer. So, just from a simple weight perspective, we know that will massively help. I love T. Colin Campbell, a name we haven't mentioned yet. His China study is often a resource that I refer patients with cancer to, or Michael Greger's book, How Not to Die. He's got several good chapters on common cancers and the science behind them. So cancer is not quite as intuitive. It is intuitive that we eat junk food and we gain weight. People tend to see those sorts of things, but eating well and how that may affect our breast cancer risk is a little bit harder to understand.
Mhm.
And this is another area I think where we bring up the discussion of alcohol, which the USDA. The USDA is
Hey,
a dietary advocacy group, right? They have many factors at play. They have many groups that they're speaking to. They are not primarily a nutrition group. And every 5 years, the USDA will take all of the latest research, consider it, and put out dietary guidelines based on it, but also with some other parties' influences at play. So we know from a cancer perspective, and if you look at the American Cancer Society, the American Institute for Cancer Research, we know that, you know, as close as you can get to no alcohol will reduce your risk of most every cancer. However, the USDA is, I don't think people can handle that, and they'll say, okay, so women, you guys can have up to 7 drinks a week, men, you can have up to 14. But yeah, that's another area that I think a lot of people don't even realize, or they may be drinking alcohol, they don't even think about how that can contribute to poor sleep, which then can lead to fatigue the next day. They don't want to exercise, they don't want to eat well, etc. Anyway, so yeah, so cancer, for sure, a more plant-based diet is unanimously recommended by our cancer authorities. And if you look at their websites, they may recommend it to different levels, right? Some will say, oh, more Mediterranean, which, more Mediterranean is more plant-based. I still think you can go a step further than that. Um, the American College of Lifestyle Medicine, of course, will recommend, a more plant predominant diet than just a Mediterranean diet. Um, But yeah, in general, more plant-based is what the research shows. It's just a little bit harder to convey that to patients because these concepts are harder to grasp. But in general, I will show a chart of nutrient density and just use that to talk to them about how if we choose more nutrient dense foods, those tend to be more anti-inflammatory. Most cancers are inflammatory in nature, and that will help minimize our risk of cancer or cancer recurrence down the
Yeah.
road.
I always find, and you mentioned T. Colin Campbell in his research at Cornell with casein and
Yes. Oh,
the
yeah.
number of Americans that are consuming probably 2 to 4 to 5 servings of dairy a
I
day,
know.
all
Yeah.
that casein that's accelerating
Right.
dormant tumor and cancer growth.
Prostate cancer, especially. Yeah.
Yeah.
I mean, I drank milk all through medical school because I thought it was healthy. I was always interested in nutrition from a young age, but I didn't really understand plant-based diets until I worked with John McDougall. But
Yeah.
I was like the only one of my roommates who drank milk in undergrad. Yeah, I guess it was 2014. So it was my final year of medical school that I worked with John McDougall. But yeah, I consumed dairy because I thought it was healthful, and it just totally blew my mind to learn that perhaps it was not.
Yeah. Yeah.
That was eye opening. I almost, when McDougall brought up those concepts, I was like, oh come on, like it just went against like everything I knew and believed. And as a kid who went to public school, I had all those posters up from the USDA about getting 2 to 3 servings a day. So, yeah, that was huge, and I see it in the office. I mean, dairy, of course, is a cancer risk factor, although that's not as intuitive to people. But acne, that's a really easy one for an adolescent who has acne. That's a great way. Usually, when my patients do have acne, I also check their cholesterol because, again, everyone has high cholesterol until proven otherwise, and then I can get them moving to a plant-based diet. We can see the lipids improve. We can also see their face clear up a lot of times.
Yeah. Yeah. It was interesting. I had Dr. Alan Goldhammer from True North Health
Yeah,
Center
yeah, yeah, yeah.
on the podcast not too long ago. And he was talking about, if you're 20 pounds overweight, you've got all this visceral fat on your
Mhm.
organs. And he said, if you're 20 pounds overweight, essentially you're carrying around a 2-pound tumor, 30 pounds, 3, 40 pounds, 4. And what that is kind of omitting, secreting. And
Mhm.
I never heard it put that way before.
Yeah.
And just how being overweight really is such it's like inflammation, and it puts you at just that much higher risk factor for all these chronic Western diseases.
Right, yeah, visceral fat for sure is hormonally active. One of
Correct.
the simplest ways that someone can assess their visceral fat is with a bioimpedance scanner, and that will, tell you how much you have. You definitely want less than 4% visceral fat. Less than 3% or 3% or less would be ideal.
So
But
tell
yeah,
me,
that's a huge thing that people don't,
yeah.
really think about.
So you mentioned, so you got out of medical school in 2014.
Yep, did my residency down here in Greenville,
You,
14 to 17.
you are young. You are so young.
I caught the wave of lifestyle medicine. I caught the wave,
you really did. I'm wondering, and where did you go to medical school?
Eastern Virginia Medical School, and I did
Eastern.
my undergrad
Yeah.
at University of Virginia.
And how many people were in your class? Can you remember?
120.
120 were in your graduating
Mhm.
class.
Yep.
And let me ask you this. Of those 120, how many do you think are also enthusiastic about lifestyle medicine?
One. I ran into one at our medical conference.
Seriously?
So total just like hadn't seen him in forever. And I did a talk at ACLM a few years back, and he was in the audience and he came up after to, say hi. But one that I know is enthusiastic about lifestyle medicine.
Wow.
I know,
Well,
I know, I
and
know.
so,
Well, I also haven't touched base with them in a long time, but in our
uh,
connections on social media, I don't know that anyone else has
yeah,
pursued
yeah.
that road.
No, I get it, but let's just say it was, 12. I mean, 12 would be 10%. So it looks like it's more like 1%, maybe
I
2%.
know. I know, I know. We do have a good group in Greenville, though. I mean, we've got our oncology department. There's a lot who are lifestyle medicine certified within cardiology for sure. I've got a smattering in different specialties that will refer to me. Whenever I get a doctor that refers to me, I'm like, good, okay, they get it. They really value what I'm doing in lifestyle medicine. So it's always nice to get new referrals. When I have new providers referring to me, I'm like, good, all right, they get it. So I think we are starting to see more and more people. And, I think all of us enter medical school because we do want to help people. That is what we want. But, like if you haven't been introduced to lifestyle medicine,
Yeah. You just,
I
yeah,
can't
you
blame
don't,
them. I
yeah,
mean, it was my experience with McDougall that really opened my eyes. Because even in medical school, I just thought nutrition was like a side interest. I didn't think it was like relevant to what I was learning in medical school and to my future career,
well, that,
unfortunately.
yeah, but isn't that super frustrating? And doesn't that somehow need to be rectified where
Yeah,
where
yeah,
we got to go upstream to the medical schools where,
I
hey,
know.
you know what, the most powerful tool in your medical toolbox when you get out of
I
here
know.
is going to be the food. And even the fact that these medical schools, I've heard about this since I wrote my first book in 2009, that they're just not teaching nutrition in medical schools, and they're still not, like 15 years later, for the most part.
Yeah, yeah, we're getting there. It's all wrapped up in
Well,
politics and
yeah.
society, and we're getting there.
No,
Um,
I like
you
your
know,
optimism. I love your optimism. Absolutely. And we got to get there. I mean, this is the solution, and I don't know if it'll be
yeah,
5 years or 40 years, but we're gonna get there.
right. Well, I don't, a lot of us doctors are frustrated when patients don't listen to us or when they look elsewhere. But in part, I don't blame them because in a lot of ways, the medical community has not solved their problems. And that is part of the reason why patients are looking to social media. They're looking at all sorts of, you know, alternative practitioners. They have not found the answer within allopathic medicine. And so they're looking elsewhere. So
Yeah.
I,
Well,
I
what
don't blame people. As frustrating as it is as a primary care provider to deal with people who come in who have all sorts of misinformation that they want to discuss with me. I mean, that is very frustrating. But at the same time, I don't blame them because they are ultimately looking for a solution.
mhm, mhm. I was just talking to a guy that I'm kind of coaching the other day, and he has lost 100 pounds in a year, and his doctor is just flabbergasted. He said he's never seen anything like this. And he said, the gentleman that lost 100 pounds and reversed all of his chronic Western diseases said, I think that you should tell your other patients about whole food plant based. And he's like, I can't even get my patients to take their meds. How am I going to get them to go whole food plant based? And that's the thing that I think is so frustrating to me, is that if these physicians were doing it themselves like you are, right,
Hmm.
then it would
Right.
be a completely different conversation they're having with their patients. But when they're not doing themselves and their patients aren't doing their meds, it's like they're not able to see it, right?
Yeah. I
So
mean, we're up against culture, and that's why in my patients who are pre-contemplative,
yeah.
that's why I just refer them to the Forks Over Knives documentary. Like that's a
Mm,
great place to start. Um, so it is difficult, and then of course that thought, oh, patients aren't willing to do it. Well, I think patients would be willing to do it if they had the information. I do find a lot of my patients are really motivated, right? We as providers always say, oh, they're not going to do it. They're not motivated. My patients are motivated, but a lot of times they have the wrong information, right?
mhm.
And so that's a lot of the reason why I will challenge people for 6 weeks or whatever time period to make those changes. And
What
then once they see the result at the end of 6 weeks, they're positively reinforced to continue on that path.
Yeah. So you said some of your patient or some of these patients have the wrong information. And you and I both know there's so much noise, so much distraction that's going on, right? I mean, out there. What to you is one of the most obnoxious types of wrong information that you are hearing or seeing about right now?
Oh, there's so much, but one example I always bring up is like bulletproof coffee. Like, how could we be so confused that we are putting butter in our coffee? I mean, that is one. There's always something trendy. I mean, the lectins, the don't eat beans, or, if you eat beans, you got to pressure cook them. I mean, beans are like the ultimate health food. They're the ultimate health food. Every study tells us that, beans are healthful. So that's another frustration. What else?
What about have you heard about this latest diet? And it's maybe uh, 8 months old, 10 months old. It's called the lion diet, where you actually eat like a lion. It's just meat and
No, actually, I don't know that one.
it's meat and
But
salt and water. Period.
yeah, even just a simple paleo diet, if you
Yeah,
are going to eat like the paleo people, it's probably going to be heavier on gathering and not quite as heavy on hunting. And also, you should be burning, many, many, many calories a day with all of your work that you are doing, as opposed to us being generally sedentary in our current lives.
yeah.
I mean, and then there's, the blood type diet,
Oh,
those
that.
sorts of things where patients come in. Well, and uh, you have to show respect for your patients. And again, everyone is looking for a solution, but patients come in with this misinformation. I have to sort of talk them out of what they're doing. And then I need to sort of educate them in the direction that
Mm,
they need to move, which of course is going to be more plant-based. So I would say social media and the internet have made our jobs harder as physicians for
yeah.
sure, because there's just a lot more that patients are getting into and getting interested in, and trying to like make sure they steer in the right direction. And sometimes I get patients and they do amazing and they're awesome, and then all of a sudden they discover something and they, okay, fell off a bit. But
Wait,
that's
wait,
why on that
wait. That's a bright, shiny object that I need to chase.
I know.
Yeah.
It's difficult, but we're up against society in primary care, and so I like to think we are doing a good job within, lifestyle medicine training practitioners to
Yeah.
motivate their patients to make changes, but also we need things that like PCRM is doing, and ACLM, that's the Physicians Committee for Responsible Medicine in DC,
Yeah.
and the American College of Lifestyle Medicine. We need to also work on the advocacy level.
In looking at your website, it looks like you've done a really nice job of showing several of the restaurants in the area that are whole food, plant-based friendly. You might be able to get, minimal or no added oils there. I was very, very intrigued by one called the Sun Belly
Oh,
Cafe
yeah.
that is close to the Swamp Rabbit Trail. What in the
Oh,
world is
yeah.
the Swamp Rabbit Trail, and how do I get there?
I know, right? Swamp rabbits are like a Greenville thing. So I guess there was a railroad called the Swamp Rabbit Railroad, which is no longer a railroad, and they've turned it into a huge walking trail. So Greenville is actually really an incredible community. It's been very thoughtfully designed, and there is a lot of infrastructure for walking and biking, which is wonderful. I love to go on the trail, take my bike out, and it's refreshing to go out there and just see hundreds of people who are also being
Yeah.
active. So I do love that we have that in our community, and our community has put a lot of money towards not only maintaining it but expanding it. I feel like every 9 months we get another news release that we're expanding the trail to go to this area. So Greenville is a fairly new city, which has been um, a really great opportunity for me completing my residency here in 2017. Again, I just feel like I'm catching it on the upswing. Greenville's really grown a lot in the past decade. Has been just a great area to practice lifestyle medicine. And yes, Sunbelly Cafe is got to be my go-to restaurant.
Oh,
Deb Bouts owns it, and she is wonderful. And I feel like she's been doing plant-based since before plant-based was a thing. As you know, 10 years ago, back when I worked with McDougall, plant-based was not a term anyone knew. But now, today, you are seeing many more restaurants embracing that. Unfortunately, we're also seeing, more of the Impossible Burger,
Yeah.
Beyond Meat, the sham burgers out there. Um, eh, we really want to focus on whole foods, plant-based. So that's been a little tough lately as plant-based has become popular. The food industry using that term how they want and not actually to mean whole foods, plant-based as it was originally intended. But part of the reason I put that resource together for my patients is because like you said at the beginning, you have to meet people where they are. If these are people who are going to go out to lunch no matter what, you can't, oh no, you got to start doing all your meal prep and home cooking. Like, okay, if they are going to go out to lunch, what are some better options?
Yeah. What
Um,
about what's Dirty Girl like? I like their logo. Eat plants
clean
tonight.
food, dirty girl. Yeah, clean food, dirty girl.
Yeah.
Meal prep. And you'll have to check that they're still active because I haven't had a patient
Got it.
mention Clean Food Dirty Girl lately. But I have had a lot of patients who've done really well with either Happy Herbivore or Clean Food
Yep.
Dirty Girl or using one of these meal prep type resources where basically they give you a grocery list. Once a week you go to the grocery store, pick everything up, and then it has a variety of recipes using those ingredients for the week.
Yeah. On your home page of your website, you have a Virgil quote that is the greatest wealth is health.
That's right. Yes. I was listening to just the radio this morning and, just some silly, I don't even know what station it was, but they were talking about, what do rich people want? And ultimately they said on their list, top of their list is health. We
Mm,
spend all this time, working, and now I'm going through all these busy years, you know, trying to earn money for my family, trying to raise kids, so focused on living life right now. But in the end, what are we working towards? Ultimately, I want to enjoy my decades ahead. And that can be a hard concept for young people to wrap their mind around. Um, it's hard to motivate a young person to eat well because generally they feel good. Um,
mhm.
and then maybe all their labs look good. Maybe I don't have any leverage over them, but ultimately, our health is wealth, right? I mean, that is what we want in our years ahead. And I always say I prefer to work with like the 40 and up crowd because those people tend to have more medical problems, which gives me more leverage. I'm able to motivate them using that leverage. But yes, I mean, this is the time when we are young, this is the time to be investing in our health. And all those 1% changes, they sure will add up over the decades.
Yeah. Bravo. So as we sign off here, Beth, I'd like to just give a shout out to Dr. John McDougall, who had such a strong influence with you, was absolutely one of my heroes, and I know was the man that really influenced my father to go whole food plant based after he read the McDougall medicine back in the early 1980s.
Mhm.
And you talk about somebody that was fighting and was such a fighter, really till the day he died for this lifestyle. And so I think that the best thing that we can do is to continue to carry that torch on behalf of
Absolutely.
John and all these
He,
amazing
I learned
pioneers.
so much from him. Still like memorable is his, the truth doesn't change. And in residency, I did a presentation to my co-residents and attendings about using a plant-based diet to overcome diabetes and the intramyocellular lipids. And one of my attendings who just didn't buy it, he's like, "Oh yeah, find me a study that shows that." And I pulled one up. It was like from the 80s or something like that. I just pulled up, the first one I could find. He's like, "Oh, well, this is from the 80s." I was like, "Yeah, well, the truth doesn't change. This is a primary study, so it's valid." Um, that, and also just to any other practitioners who are out there, McDougall gave me some great advice. He said, in your training, just, keep your head down, go through your training, learn the medicine. When you get out on your own, you can practice however you want, which I think is great advice because as providers, I mean, I do need to know primary care. I wouldn't be very useful to my patients if I didn't know full scope primary care. Um, But yeah, really, really focusing and keeping your head down, getting your studies done. When you go out there, you practice how you want.
Yeah. Yeah.
So he was an amazing mentor and inspiration. And yeah, I mean, I just
Yeah.
can't believe he's not with us anymore. But for sure, he has influenced a lot of people who will carry his legacy forward.
Absolutely. Beth, it was such a pleasure meeting you. Thank you for all you're doing in Greenville, South Carolina, to make people healthier. It's great.
Yeah, thank you so much. It's been
Yeah.
wonderful to be on your podcast and to meet you virtually. And I'll have to catch you at one of these Black Mountain retreats sometime in the future.
I would love that. So can you give me a virtual Plant Strong fist bump on the way out? Boom. Bye, Beth.
All right. Yep. Thank you so much.
To learn more about Dr. Motley and watch some of her lectures on reversing diabetes and heart disease, you can visit her website at bethmotley.md.com. And I'll be sure to link to that website in today's show notes. I really appreciate her perspective on working as a team with her patients and to develop small, atomic habits in their daily lives that will compound over time into lasting, meaningful change. What daily habit can you adopt right now? Let's start by pressing the follow button on the Plant Strong podcast and by sharing this episode with your loved ones who just might be interested. Thanks so much for listening, and always keep it Plant Strong. The Plant Strong podcast team includes Carrie Barrett, Lori Kordowich, and Amy Mackey. If you like what you hear, do us a favor and share the show with your friends and loved ones. You can always leave a 5-star rating and review on Apple Podcasts or Spotify. And while you're there, make sure to hit that follow button so that you never miss an episode. As always, this and every episode is dedicated to my parents, Dr. Caldwell B. Esselstyn Jr. and Ann Cryle Esselstyn. Thanks so much for listening.